Miriam Daly, MEP in the European Parliament. You're from Malta, and EAPM is a smart approach to healthcare, which is smaller members and regions together. EU can learn a lot from smaller member states. What issues would you like to highlight at EU level that a smaller member state could do?
I think a foremost issue would be access to medicine in particular, because smaller member states have an issue when it comes to affordable medicines, considering also the economies of scale that smaller member states have, and it can be an issue when it comes to the expenses related to certain medicines. In a sense that larger member states would have bigger economies of scale when compared to the smaller member states, and that has an impact also on the smaller member states and on the medicines that citizens living in those member states can really access at affordable prices. So that would be a main issue that I would like to highlight in this regard, because affordability equals access in my mind, particularly when it comes to people who really need certain and particular medicines.
And you've done a lot of work to highlight different disease areas at European level, especially on breast cancer. Can you just highlight some of the activities that you've done and the need for more action for breast cancer patients?
So when it comes to breast cancer, I was one of the signatories of a written declaration which managed to garner the support of the majority of the MEPs in the European Parliament. And our main concern is to try as much as possible to put breast cancer as one of the priorities of the European Commission. I do understand that healthcare is a member state competence. We're not trying to overstep that, but the European Commission has a very important, I would say, guiding role when it comes to ensuring the standards that member states can reach or have to reach in the different individual countries. And I was glad that the European Commission is also working on new guidelines when it comes to establishing the minimum standards of care, and the fact that the Commission is not looking only at care from a traditional medical point of view, but from a more holistic point of view, because we know that cancer patients, and particularly their families, can go through a very traumatic experience when one of their own is going through breast cancer, and that is an issue that we also need to look into. So rather than simply the traditional way of looking at curing a patient, also the psychological help and support that a patient and his or her family need to have.
Philip de Backer, MEP for the European Parliament. You've done excellent work in putting healthcare on the EU political map. You involve young people involving different disease areas. What activity have you done at the European Parliament recently to support an environment for personalised medicine?
Well, we've asked crucial attention for some of the rare diseases, for example. We have tried to, through resolutions on initiative reports, to put this healthcare issue higher on the political agenda. But at the same time, we've also been trying to talk and to reach out to stakeholders, to patient organizations, to young people also, to make sure that they get involved. And we, for example, established a European Health Parliament where more than 100 young people from across Europe come together to rethink healthcare and make healthcare future-proof.
And so the European Parliament has done different work on data protection regulation, clinical trials regulation, in vitro diagnostics. Do you think this is helping the Parliament's voices change this legislation to improve this for the benefit of the patients and benefit of the citizens?
Well, I think in all European legislation, the European Parliament has a say and fundamentally changes often these proposals. But of course, there are different views in the European Parliament, and in the end, it's about balancing those views. And I think that we have always tried as members of Parliament to reach out to stakeholders, to patient organizations, to have as much input as possible to come to a conclusion and a compromise and a workable set of rules and regulations that will improve innovation, improve the healthcare situation for many, many patients, and also makes it easier for companies to come to the market, for example. So these elements we always try to take into consideration. I think that the Parliament has had a huge impact, for example, in data protection, to allow also the data of patients to be treated separately and differently, and giving that a specific situation, allowing, again, innovation and research to continue.
And you think the EU should have more of a role at improving healthcare at the national level?
Well, I think that many member states are really facing tremendous efforts in changing their healthcare systems, and so I think that European institutions can help in, for example, sharing best practices, offering more coordination, but also pushing those member states who today are not facing up to the problems that their healthcare systems have, in pushing innovation and pushing new reform through. So I think that the European level should be and could be more active and more helpful also in transforming healthcare systems and making them future-proof.
Tanya Bornieski from Illumina. Why did Illumina join the European Alliance for Personalised Medicine?
Good question. Illumina thought it was really important to join the EAPM simply as leaders of genomics. We wanted to get closer and better understand patients, patient advocates, members of parliament, policy advisors, and the general public to really talk about the benefits of genomics and integrating it into healthcare.
So today we had a conference which Illumina spoke at and participated at, and we had a roundtables on new models for clinical trials, on data protection, and on access and value. What were the key messages that you heard from the multi-stakeholder participants at the conference?
Yeah, probably the topic I heard people speak about most was how everything coming around from data analysis to communications and policy has to be around the patient. Everything needs to be patient-centric, with the patient's needs, wants, and benefits to come first.
I'm Evanson from the Ministry of Social Affairs. Today we had a conference on personalised medicine. You're coming from the ministry in Estonia. What has Estonia been doing in the area of personalised medicine, and what could Europe learn from Estonia as well?
In Estonia, the government at the highest level, at the Prime Minister's level, has told that we need personalised medicine. Actually, it was our previous Prime Minister 3 years ago who openly said that this is the future for Estonian healthcare. So currently we have put together a national strategy for personalised medicine, which includes a robust e-health infrastructure, which also includes clinical translation, so basic research introduced into a clinical everyday application, and which also includes engaging engaging 10 times more patients with personalized medicine. So currently we have Biobank, which has 5% of the population, it's 50,000 individuals, and we intend to raise that in the next 4 years into 500,000 individuals.
Why did Estonia take a focus in the area of personalised medicine?
Well, this is the future. But also we know now that since we have 15 years of Biobank, we have 9 out of 10 citizens supporting more services based on personalized medicine. And we have robust infrastructure which enables data sharing in a secure and smooth way. So putting all that together, it just seems meaningful.